9. Acute coronary syndromes, ACS. Acute coronary syndromes, ACS, refer to a group of clinical conditions that involve a sudden decrease in blood flow to the heart muscle due to the partial or complete blockage of one or more coronary arteries. ACS encompasses a spectrum of conditions, including unstable angina, non-ST segment elevation myocardial infarction, STEMI, and ST segment elevation myocardial infarction, STEMI. These conditions are serious and require prompt medical attention. Here's an overview of ACS. Unstable angina. Unstable angina is a serious and potentially life-threatening medical condition characterized by chest pain or discomfort that occurs unpredictably and often at rest or with minimal exertion. Unlike stable angina, which follows a consistent pattern and is typically triggered by specific activities or stress, it is more concerning because it can occur suddenly and is not easily relieved with rest or medication. Key features of unstable angina include chest pain or discomfort. The most common symptom of unstable angina is chest pain or discomfort. This pain is often described as a heavy, squeezing, or pressure-like sensation in the chest. It can also radiate to the neck, jaw, shoulder, back, or arm. The pain is usually severe and may last longer than 20 minutes. Unpredictable occurrence. Unstable angina episodes can happen without warning and may occur at rest or during routine activities that previously did not trigger angina. Increased frequency and severity. In people with a history of stable angina, unstable angina represents a worsening of symptoms. It may occur more frequently, last longer, or be more severe. Not easily relieved. Unstable angina is often not relieved by rest or nitroglycerin, which is a medication commonly used to relieve angina symptoms. This is a critical distinction from stable angina. Unstable angina is a sign of an underlying problem with the coronary arteries, typically atherosclerosis, which leads to reduced blood flow to the heart muscle. It is considered a medical emergency because it can progress to a more severe condition, such as a heart attack, myocardial infarction. Causes and risk factors. Unstable angina is primarily caused by the disruption of atherosclerotic plaques in the coronary arteries. When a plaque ruptures or becomes inflamed, it can lead to the formation of blood clots, which can partially or completely block blood flow in the artery. Risk factors for unstable angina include 1. Smoking. 2. High blood pressure. 3. High cholesterol levels. 4. Diabetes. 5. Older age. 6. Family history of heart disease. 7. Obesity. 8. Sedentary lifestyle. Diagnosis and treatment. Diagnosing unstable angina involves a combination of medical history, physical examination, an electrocardiogram, ECG or EKG, cardiac biomarker blood tests, to check for heart muscle damage, and often additional imaging tests. Immediate treatment for unstable angina typically includes 1. Administering aspirin to reduce the risk of blood clot formation. 2. Providing medications to relieve chest pain, such as nitroglycerin. 3. Administering antiplatelet drugs and anticoagulants to prevent further clotting. 4. Possible admission to a hospital for close monitoring and further evaluation. Long-term management may involve lifestyle changes, medications, such as beta blockers and statins, and sometimes invasive procedures, such as coronary angiography and angioplasty with stent placement, to address the underlying coronary artery disease and reduce the risk of future episodes. 2. Myocardial infarction, MI. Myocardial infarction, MI, commonly known as a heart attack, is a serious medical event that occurs when there is a sudden and complete blockage of blood flow to a portion of the heart muscle. This blockage deprives the affected area of the heart of oxygen and nutrients, leading to heart muscle damage or death. Here are key points to understand about myocardial infarction. Causes. A heart attack is usually caused by the rupture of an atherosclerotic plaque in one of the coronary arteries. This rupture triggers the formation of a blood clot, thrombus, which can block the artery and interrupt blood flow to the heart muscle. Atherosclerosis is the underlying condition characterized by the buildup of fatty deposits, cholesterol, and other substances in the arterial walls. Symptoms. Common symptoms of a heart attack include 1. Severe chest pain or discomfort, often described as crushing, squeezing, or pressure-like. 2. Pain that may radiate to the neck, jaw, shoulder, back, or arm, typically the left arm. 3. Shortness of breath. 4. Cold sweats. 5. Nausea or vomiting. 6. Lightheadedness or dizziness. 7. Anxiety or a feeling of impending doom. Diagnosis. The diagnosis of a heart attack is based on a combination of medical history, physical examination, electrocardiogram, ECG or EKG, and cardiac biomarker blood tests, for example, troponin. The ECG can show characteristic changes, such as ST segment elevation and in the case of an ST segment elevation myocardial infarction, STEMI. Cardiac biomarker elevation in blood tests confirms heart muscle damage. Types of heart attacks. There are two main types of heart attacks. 1. ST segment elevation myocardial infarction, STEMI. In a STEMI, there is a complete blockage of a coronary artery, leading to significant heart muscle damage. It is considered a medical emergency, and immediate reperfusion therapy, usually percutaneous coronary intervention or PCI, is necessary to restore blood flow. 2. Non-ST segment elevation myocardial infarction, STEMI. In an STEMI, there is a partial blockage of a coronary artery, resulting in heart muscle damage that is less extensive than in a STEMI. Treatment may involve medications and interventions, depending on the extent of the blockage. Treatment. Immediate treatment for a heart attack includes 1. Administering aspirin to reduce blood clotting. 2. Providing medications to relieve chest pain, such as nitroglycerin. 3. Administering antiplatelet drugs and anticoagulants to prevent further clot formation. 4. Reperfusion therapy, such as PCI or thrombolytic therapy for STEMI. 5. Oxygen therapy and pain relief. Long-term management includes medications, for example, aspirin, beta blockers, statins, to prevent future heart events, lifestyle changes, for example, diet, exercise, smoking cessation, cardiac rehabilitation, and possibly invasive procedures, for example, coronary angioplasty and stenting or coronary artery bypass grafting, to treat underlying coronary artery disease. Some other disorders of arteries. A. Kawasaki disease. Kawasaki disease, also known as Kawasaki syndrome, is a rare but serious childhood illness that primarily affects children under the age of 5. It is characterized by inflammation in the walls of medium-sized arteries throughout the body, including the coronary arteries, which supply blood to the heart muscle. Kawasaki disease can lead to coronary artery aneurysms and other complications if not promptly diagnosed and treated. Here are key points to understand about Kawasaki disease. Causes. The exact cause of Kawasaki disease is not known, but it is believed to involve a combination of genetic, environmental, and immune system factors. It is not considered a contagious disease. Symptoms. Kawasaki disease typically presents with a range of symptoms that can develop in phases, including 1. Fever. 2. Conjunctivitis. 3. Rash. 4. Swollen, red lips, and strawberry tongue. 5. Swollen hands and feet. 6. Swollen lymph nodes. 7. Irritability. Complications. Kawasaki disease can lead to serious complications, the most concerning of which is the development of coronary artery aneurysms. These are abnormal enlargements of the coronary arteries that can increase the risk of blood clots, heart attacks, and other cardiovascular problems. Other complications may include inflammation of other blood vessels, joint pain, and abdominal symptoms. Treatment. Early treatment is crucial to reduce the risk of coronary artery aneurysms and other complications. Treatment typically involves intravenous immunoglobulin, IVIG, and high-dose aspirin. IVIG helps reduce inflammation and may prevent coronary artery damage. Aspirin is used to reduce fever and inflammation. Once the fever subsides, the aspirin dosage is lowered to reduce the risk of blood clotting. Follow-up care is essential to monitor coronary artery health. B. Buerger's disease. Buerger's disease, also known as thromboangiitis obliterans, is a rare and serious vascular condition that primarily affects the arteries and veins in the extremities, especially the hands and feet. It is characterized by inflammation and the formation of blood clots, thrombi, in the affected blood vessels, which can lead to reduced blood flow and tissue damage. Buerger's disease is strongly associated with tobacco use, and smoking cessation is a crucial part of treatment. Here are key points to understand about Buerger's disease. Causes and risk factors. 1. Buerger's disease is strongly linked to tobacco use, particularly cigarette smoking. It is one of the few vascular diseases that has a clear association with smoking. 2. The exact cause is not fully understood, but it is believed that tobacco or other environmental factors trigger an abnormal immune response that leads to inflammation in the blood vessels. Symptoms. 1. The hallmark symptom of Buerger's disease is intermittent claudication, which is pain, cramping, or discomfort in the legs or, less commonly, the arms during physical activity. The pain typically improves with rest. 2. Other common symptoms may include cold or numb extremities, discoloration of the fingers or toes, turning pale, blue, or red, and the development of non-healing ulcers or sores, particularly on the fingers and toes. Treatment. 1. Smoking cessation. The most important aspect of treatment is to stop smoking or using any form of tobacco or nicotine products. This is crucial to prevent the progression of the disease. 2. Medications. Medications to improve blood flow and manage symptoms may be prescribed. These may include antiplatelet drugs, to prevent blood clots, and medications to dilate blood vessels. 3. Lifestyle modifications. Maintaining good hygiene and taking measures to protect the extremities from cold and injury can help prevent complications. 4. Surgery. In severe cases, when the disease has led to gangrene or non-healing ulcers, surgical interventions like sympathectomy, cutting sympathetic nerves to improve blood flow, or bypass surgery may be considered. See Raynaud's disease. Raynaud's disease, also known as Raynaud's phenomenon or Raynaud's syndrome, is a condition that primarily affects the blood vessels in the fingers and toes, causing them to temporarily constrict or narrow in response to cold temperatures or emotional stress. This constriction limits blood flow to the affected areas, leading to color changes, usually white, blue, and then red, and sensations of numbness, tingling, or pain. Raynaud's disease can be uncomfortable and, in some cases, may signal an underlying medical condition. Here are key points to understand about Raynaud's disease. Types of Raynaud's. There are two main types of Raynaud's. 1. Primary Raynaud, also known as Raynaud's disease. This is the most common form and typically occurs without an underlying medical condition. It is often less severe and manageable with lifestyle changes. 2. Secondary Raynaud. This form, also known as Raynaud's phenomenon, is typically associated with an underlying medical condition, such as autoimmune diseases, like scleroderma or lupus, connective tissue disorders, or vascular diseases. Secondary Raynaud's tends to be more severe and may require treatment for the underlying condition. Symptoms. 1. The hallmark of Raynaud's is the color changes in the affected fingers or toes. These changes usually follow a specific pattern: white, lack of blood flow; blue, due to reduced oxygen supply; and red, as blood flow returns. 2. Other common symptoms include numbness, tingling, and a sensation of cold in the affected areas. 3. Raynaud's attacks are often triggered by exposure to cold temperatures, but emotional stress and other factors can also bring on symptoms. Causes. 1. The exact cause of primary Raynaud's is not well understood but is believed to involve an abnormal response of the blood vessels to cold or stress. It may have a genetic component. 2. Secondary Raynaud's is typically associated with an underlying medical condition that affects blood vessel function. Treatment. 1. Management of Raynaud's disease involves lifestyle modifications and, in some cases, medications. 2. Lifestyle changes include keeping warm, wearing layered clothing, using hand and foot warmers, and avoiding triggers like cold temperatures and stress. 3. Medications that may be prescribed include calcium channel blockers to relax blood vessels and improve blood flow, and other vasodilators or medications to address underlying conditions in cases of secondary Raynaud's. Complications. 1. Raynaud's is usually not dangerous on its own, but severe and frequent attacks can lead to tissue damage, ulceration, and, in rare cases, gangrene. It's essential to manage the condition to prevent complications.